good morning, and welcome to the Brenda Perryman Show right here on TV 33, WHPR, Comcast 20 in Detroit, and all over the world, courtesy of the World Wide Web, www.tv33whpr.com, and we also have an app. All you have to do is say WHPR. There's an app on your Android or your iPhone, so you can watch us all over the place. And today I have a wonderful, wonderful show. In my second segment, do that first. I have Dr. Sabrina Jackson, and I cannot wait to speak to her because she has the book, He Is Not a Statistic, 12 Laws for Single Mothers Raising Black Males. And having been a single mother myself, raising a male, right on, Sabrina. And I have my sponsors, the Dr. Ronald and Blake Livingston. Sorry about that. And it's Meet the Dentist today. And you know it is getting to be spring. And we're out and about, and our smile has to come correct. Isn't that right, doctors?
That's correct. Smile. It's time for spring cleaning.
Spring cleaning. Oh, Lord. Spring cleaning. When you say spring cleaning, and good morning once again.
Good morning. Glad to be
When
here.
you say spring cleaning, what do you mean?
It means making sure that you have a healthy oral cavity, like you have a healthy body. You know, a lot of people, and we watch these shows all the time, the Dr. Oz's and the like, and it emphasizes taking care of your health, but they rarely mention your mouth. And if your mouth is not healthy, the rest of your body can't be healthy.
Absolutely, and especially since we put so much in our mouths.
That's correct. If we're lucky.
What do you?
I mean, if we're lucky to have good food.
Yeah, good food, even bad food. We put bad food and it sticks in our teeth.
Right.
Tell me, what do you think about gummy bears? I know that's a crazy question, but I was watching somebody on television and they were trying to talk and they said, I have this gummy bear in my mouth. And it was hard them getting it off.
Well, gummy bears are probably one of the worst candies for teeth because when you look at the different types of food, the ones that are worst for you are the ones that are the stickiest, and then obviously the high sugar content. The stickiness of it is bad because it's harder for you to get it out of there, and it sits there for a long time. They're slow to dissolve, and they sit there and they stick to all the surfaces, including in between your teeth, which nobody likes to floss.
Right. And we tend to see at least once a month, usually an adult will come in who's chewing a taffy or gummy bear or something like that and pull off a crown.
Oh, that is right. A crown. Do they have, is a cap the same thing as a crown?
Yes, cap is a crown, just different terminology.
Oh, okay, because I
Yeah.
used to hear cap.
Yeah,
My
cap and
cap.
crowners are just the different words for the same appliance.
Okay, well, before we start, I noticed we have a fourth person here on the set,
Right.
but he's not all there.
No, he's not all there. This is a friend of ours. He came to the show today, and this is actually a live, a real human skull. This is not a plastic one. I don't think you can get real
Oh, that's
ones
a
nowadays.
real human?
Yeah, this is a real human
Oh,
skull.
okay, I'll do
Back when I went to dental school 30 years ago, we got real stuff, real skulls. But nowadays everything's made out of plastic. But I just brought this to demonstrate the effects of bone loss from gum disease. And I don't know if we can get as good a picture as we want, but what we have here is the bone level where the root should cover. And now we have all this area here where the bone has deteriorated down to this level, and these teeth have become loose. And you can see some of the
Oh,
teeth
okay.
in the front are actually missing.
So, yeah, we see, well,
It's okay.
um,
He won't bite.
no, I noticed the red line. Everybody, there's a red line right in the middle where the gum should come down
Correct.
to a red line.
Right.
Because if you could look at this, you see there are teeth, but there's a red line. The gums have receded.
Correct.
The thing you want to get out of this is that your gums are supposed to cover all of your root surfaces. And then once you start to get bone loss from gum disease, that's the main thing that gum disease or periodontal disease does, is it destroys the bone that supports the teeth.
Okay, so do any of you ever see your roots of your teeth? I mean, that's because I've known of people to see their roots.
Yeah, and like we talked about last time, the phrase long in the tooth. That's due to the root surface being exposed, and people used to think that over time, as you get older, that your teeth are supposed to look longer. You get long in the tooth, but really, what it is, it's due to gum disease. The gum's pulling away from the teeth.
So how can people prevent this or stop it? Can you stop it once it starts?
Well, there's 2 stages of gum disease. It starts at gingivitis, and we all heard gingivitis. They talk about it on every toothpaste commercial on the planet.
There's a little diagram.
And gingivitis is when there's inflammation, bleeding, puffiness. If you get bleeding when you brush, that's gingivitis. Okay, we got a little diagram here. You can't really see it.
The other side you can.
Here we go. And what happens is that little triangle of gums right next to the tooth, it gets inflamed, and that advances to gum disease. Okay?
How can you tell? How can you tell you might be developing or have gingivitis again?
Gingivitis is defined by puffiness, redness, and pain. Okay.
And bleeding.
Now, you may not have all 3 of those or all 4 of those things, but if you have any of those things, then there's some gingivitis going on at the very least.
Gee, so once you think you might have gingivitis, I come to you, the dentist, and what would you do?
We treat gingivitis. Gingivitis is reversible. Okay, gingivitis is just simply that inflammation. There's no destruction of the tissue yet. So gingivitis, we'd get you cleaned up. Most likely, there's a buildup of soft plaque and possibly tartar below the gum line that's causing irritation.
Speak to what plaque and tartar are again.
Plaque is when food breaks down in your mouth. It reacts with the bacteria that's in your mouth and forms a soft substance on your teeth.
Yeah, it's like a film.
Correct. That's exactly right.
It's a biofilm.
Right. It's called biofilm, and it adheres to your teeth. And then you get it off by brushing or flossing. But tartar is when that plaque sits. Usually it takes about 24 hours, but once that plaque sits, it gets hard. Okay? And tartar can only be removed with a professional cleaning. Now, you can scrape real hard with something, and it might come off of there, but you're at risk of damaging your gums or your teeth.
Oh. Okay. So gingivitis, we've let that go.
Okay.
And then after gingivitis, if we don't take care of that,
gingivitis advances to gum disease or periodontal disease. Okay. And periodontal disease is what happens is that gum that's inflamed, it starts to unattach from the tooth. Okay. So you start to develop a pocket around that tooth, and you'll hear that often when you talk to your dentist about pockets around the teeth. Pockets is where the gum has come unattached from the tooth. Plaque, bacteria, food, whatever can build up in those pockets.
Okay.
And that's an infection. And your body is constantly fighting that infection. And you basically have a chronic, low-grade infection in your mouth all the time.
Now, an infection can incite a fever, can't it?
That's correct. If you have severe gum disease, it has to be pretty bad for you to develop a fever from your gum disease, but it's possible.
It's possible in that you would get an infection. That infection will cause a abscess, and people have had abscesses.
That's dangerous.
Right, and once you get an abscess, you can get abscesses from several different situations, but there's a periodontal abscess.
With an abscess, wouldn't your jaw get big?
Usually with a periodontal situation, your gums would get very swollen. They would be very tender. The tooth may even become loose temporarily. May hurt when you bite on it. It'll feel like that tooth is higher than the other tooth, and that'll make you get to the
temporarily.
Dentist. Temporarily in that if we get to it early enough and we take care of it, we treat it, antibiotics, and say deep cleaning, scaling, and root planing, then we can reverse that situation. It goes back to normal if we catch it early enough.
We have Theo on the line. Good morning, Theo. Good morning.
Good morning.
Well, happy Friday to all. Happy Friday to all of you.
Happy
Thank
Friday.
you.
Friday to you too.
You
I was calling to ask if you know anything about pulling, and there are different schools of thought on it. Can you tell me yours?
On chlorine, you said?
Could you repeat
Chlorine.
Can you repeat
No,
what you said?
pulling.
Pulling?
that? Like removing a tooth?
I'm not understanding that.
No. It has to do with oil. People will take
Oil pulling.
say an ounce or so of say olive oil as an example, and they swish it around in their mouth for approximately 20 minutes. It's supposed to
I'm familiar with oil pulling.
alleviate bacteria,
I'm
and
familiar with oil
so they
pulling.
say.
Okay, before he answers that, we want to tell Tyrone to call back because he got cut off or something. I don't know what happened, but anyway.
Oil pulling. First of all, there are studies about oil pulling.
What is oil pulling?
Oil pulling is where you want to take. First of all, the studies show that oil with high fat, saturated fat, coconut oil is what you're supposed to use for oil pulling. However, you have to oil pull for 20 minutes to even show any evidence of destroying any bacteria. What you do is you take the oil in your mouth and you swish it around for 20 minutes. Coconut oil. And you swish it around for 20 minutes, and it's supposed to have bacteria static properties. What that means is the bacteria doesn't multiply anymore.
Doesn't kill it, but it doesn't.
It doesn't kill it, but it doesn't make the bacteria multiply anymore. Now, that takes 20 minutes, and it doesn't kill bacteria. It only makes them stop reproducing. Whereas you could take 2 to 5 minutes and brush and floss your teeth with mouthwash, toothpaste, just simple manual movements, and do infinitely more good for your teeth than any oil pulling will ever do. So, while oil pulling does have some effect, the amount of time that you're putting in to not have to floss or brush your teeth is the benefits are negligible, I think.
And see, that's something he's telling me.
Because I try to keep up with alternative medicine and what they're saying about dentistry and alternative medicine and things like that. But a lot of the things that they suggest, the benefits just aren't there, unfortunately.
Does that answer your question, Theo?
Yes, thank you.
Thank you.
Thank you.
Have
Thank
a good
you.
weekend. We have Tyrone on the line. Good morning. Good morning.
Good morning.
How are you?
Good morning.
How's everybody?
Everybody's good.
Do you have a question?
Okay, Ms. Perryman, I want to thank you for letting me know about Mr. Livingston and his son. And I had some dental work done, and I think they did excellent work. But one of the big things is they helped me with the financing of it. They made everything very convenient for me and my wife. They also done work for my wife too. They have a lovely office. The staff is great, but I really like the service. They open the door for you. They make sure you can get in and out of your car. They make sure you get back in your car. Then you can ask them dumb questions over and over again, and they seem to handle it. So I just want to say thank you very much.
Oh, and thank you, Tyrone. We're glad you're happy.
Well, we're glad you're happy too, Tyrone. Good to hear from you.
Yeah, thanks for calling in.
And the missus, tell her we said hello.
Wow, that was a good commercial, wasn't it?
Yeah, that was great.
That was a great commercial.
He did find out about us from your show.
Yeah, he did. He did.
Oh,
he
well,
did.
that's wonderful. Once again, before we even go on, tell us where you're located and phone number and about your website.
Our address is 13724 Woodward Avenue, right in Highland Park, 2 blocks north of the Davison. Our phone number is 313-883-3050. There's people there right now. And our website is www.livingstondentistry.com. You can find out all the information you want about us and our office on there.
Right, absolutely. So we had been talking about gingivitis, and then we talked about the gum disease and everything.
Right.
What happened to, well, will they have to get their teeth pulled out now?
Well, in this situation here, you see this patient from somebody did end up losing these front teeth, and probably from the looks of the bone loss there, they lost them due to the extreme bone loss they had around those teeth, and that's usually from untreated gum disease. Now, this skull may be 50, 60, 70 years old when I got it, and I got it back in the 80s. So back then, of course, the technology and the treatments weren't as advanced as they are today. But the good news is that early gum disease situations that have to be treated can be treated usually without any anesthetic needles anyway. Sometimes we'll numb up the gums a little bit with a paste, and we'll use our hygienist, who's very gentle. We'll do what's called a deep cleaning, scaling, and root planing, and within 1 or 2 visits, we can have the patients in good shape, along with antibiotic rinses that we use that are prescription, that patients get an excellent result. We've always found, too, that once patients get that situation taken care of, their mouth feels so much better. They never allow it to go back that way again.
I just want to make a quick note about gum disease. When you have gum disease, the bone around the teeth gets destroyed. We can't gain that bone back. But what we can do is prevent further bone loss from occurring. So our objective when we do deep cleaning or scaling is to remove the plaque and tartar and the bacteria that's in the pockets around the teeth so the gums can attach to those teeth.
I had a question, but we have
Yeah.
Paul on the line. Good morning, Paul. Good morning. Hello?
Good morning.
Hi.
Good morning,
Good
Miss
morning.
Brenda and gentlemen.
Good morning.
Good morning.
I'm going to talk, and you guys, it's hard to hear over the phone, but let me tell you, I know you guys are super, super smart.
Okay.
That's the problem about I need a new dentist.
Okay.
I don't want everybody, Meridian is what I got, my plan, but I go to Obama, I guess we got March 31st, we got to sign up for something, but I do want to go to your show, your shop, but I got to wait. Give out the number. I've been waiting almost a half hour to
Oh,
give out.
We did
I'm
give
not
the number.
crying
again.
it all. I love that, Brenda, you let me get on this phone line, but let me hang up. But the most important thing is everybody's going to go get their teeth cleaned by you, because I'm going to be the first to do.
Oh.
And I want them to also donate so we can get the phone lines fixed, so I can hear you, because I'm got it crushed to my eardrum.
Okay.
You know, and I'm gonna ask you a question, Brenda. Can I ask you a question right now?
Yes.
I hope you know Miss Leslie Nelson at Bird's Place, where she does poetry, and you have the other persons and the places of sanctuary where we have, you know, music and stuff that you go on with. And
Right.
it's really beautiful. And unfortunately, the girl from Southfield, American Idol, she got voted off, but there's still another one. But
No,
I wanted to talk
she
to,
didn't
you
get
know, Henry
voted off.
Tyler about. And by the way, let me let you go. Dionne Warwick, I love your theme song. The Supremes, what a great dream. And what we can do, I'm going to get my teeth cleaned. And let's get, I got to go, man. What a great show. Thanks, everybody.
Thank you, Paul.
They don't take it serious, but it is true.
Yes, it is.
You guys are fantastic doctors.
We look forward to seeing you.
313-883-3050.
That's right.
You got it.
You got
And I just want to put something out there. Paul mentioned Obamacare. Just want to make it very clear to everybody. Obamacare does not cover dental for adults, only for people under the age of 18. Obamacare, one of the mandates to become a qualified health plan is that any health plan has to provide dental care for people under 18 that are on that plan, but nothing for adults. I've gotten a lot of phone calls saying, I'm getting Obamacare, I'm going to come in and get dental work done. If you know of something that I don't know of, please call our office and tell us about it. But to my knowledge and what the ADA, American Dental Association, Michigan Dental Association has told us, there is no Obamacare dental. So if you are planning on getting dental insurance, please do. But
there will be an expansion under Medicaid through Obamacare for people who are in that gap where they are employed and they make too much money for Medicaid, but they will come out with they're coming out from, it was in last Sunday's newspaper, about a program through Obamacare, through the federal government, that will assist working families to get dental insurance.
right, that's a state program.
Right. And that's through Medicaid, I think, and I think it'll be maybe under Delta Dental Plan possibly.
There's going to be a few different ones.
There'll be a few different ones, but that's in the works, and it should be probably online around in April.
So that sounds good.
Oh, that sounds real good. That's why it didn't make any sense to me for people to be against something that can help people like that. People need
Right.
resources and they need help. You know, people, you know, some of these political groups claim to be so Christian, but they hate the poor.
I hate the poor.
Yeah.
Hate the poor.
You know, but they don't want them to have health care. So that's
So what you have to, I had this quick question
Sure,
before
go
we
ahead.
move on.
I like
Okay,
that scope.
I don't believe I am even touching this, honestly, but anything for my viewers.
Oh yeah, there you go.
But if I see my root and there's nothing you could do about that, do you pull the tooth or?
That's a good question.
One, you have an exposed root. If that tooth is causing sensitivity, or you don't like the way it looks, but that tooth isn't loose or anything like that, one of the things we look for also if you have recession is that tooth mobile. If that tooth's not mobile and the bone around it seems to be relatively healthy, the gum disease isn't advancing at all, what we can do is we send you to a periodontist who is a gum specialist, and they could do something called a gum graft on that tooth.
Really?
Yes, and what they do is they take gum from another area, usually the roof of your mouth, and they aesthetically place it over that tooth to make it appear natural again.
Like a plastic surgery type situation for your gums.
And there is actually a new procedure that I just heard about from one of the top periodontists in our area. It's called a pinhole procedure. There's no more cutting and suturing and all that. And what they do is they make a pinhole right above that area where the gum is pulled away, and they pull it down.
Wow,
Yeah.
amazing.
That's a very new procedure that's
Wow.
a game changer.
Things are changing and improving
Oh, they're
every
improving.
day.
They're
Very
improving.
true.
I have a silly question for you, but I'm going to ask it.
Go ahead.
Do you recommend a particular toothpaste?
You want to hear that?
Oh,
I always wonder what is
I always tell patients I recommend the one that the company provides me for free. So if they give it to me, I recommend them. But basically, I like a peroxide and baking soda type toothpaste, and there are many brands that are out there like that. So, I mean, a lot of them claim they're going to whiten your teeth and bleach your teeth, and that's not true. They don't do that. They're not going to do that. But peroxide and baking soda, I think, is about the best because you're getting the peroxide and the baking soda, which Grandma used to have us use all the time anyway.
I'm gonna interject here. Don't use peroxide and baking soda to brush your teeth. Use peroxide and baking soda toothpaste.
Oh, that's what I meant.
to brush your teeth.
Toothpaste.
right?
And also, some of those whitening toothpastes, they will do a little bit of something, but it's not going to be as much as what their claims are.
No.
Well, what about the home teeth whitening systems that people are using?
When it comes to any whitening, different people are going to have different results. I have seen good results from the Crest white strips, but I've also seen no results from Crest white strips where professional whitening was needed to get rid of some of the stains. It really depends on where the stain comes from, whether that type of whitening will work. If you have regular staining from, smoking or drinking coffee, Crest white strips might be
That's what
you
I
need.
was going to ask you. What does smoking do to your teeth?
Smoking, as we know, is bad for your whole body. Okay, smoking is a major risk for oral cancer. Smoking and drinking are the top two risks for oral cancer.
Okay, drinking too. Okay.
Yep, alcohol and tobacco.
And we have seen these cancers.
Yep. And smoking will stain your teeth, but the number one thing that smoking does is it destroys your gums. Okay.
Really?
Nicotine is a vasoconstrictor, which means it shrinks your blood vessels, which means you're limiting the amount of blood that flows to your gums and to the tissues in your mouth. So what that does is decreases the regenerative ability of those gums and also causes gum recession and fibers that connect your gums to your teeth to get destroyed.
Wow.
Yeah.
That I did not know that drinking does that as well.
No, drinking just contributes to oral cancer.
Yeah, it contributes to oral cancer, but I know a lot of people don't realize
No.
that.
Yep. And that's why you're seeing a big switch from mouth rinses with alcohol to alcohol-free mouth rinses. Because
Correct.
if Listerine is 30% alcohol. That's
Golly, that's the
60
strongest.
proof.
That's like Malibu. Okay, so you got people out here who are rinsing with Listerine every day. That's like having a drink every day for 40 years if you're
Right,
rinsing with Listerine
right.
every day.
Some people do it 2 or 3 times a day.
And that's and alcohol and tobacco are the number 1 and 2 contributors to oral cancer.
And especially with the mouthwash, you'll tend to hold that in your mouth longer as opposed to if you're having a drink, you don't hold it in your mouth, you swallow it. But with mouthwashes, people swish it around for a couple minutes and spit it out. You're coating the inside of your mouth with alcohol. And if you do that on a daily basis, and we know that because we're dentists, so we use mouthwash a lot every day, but we use alcohol-free only.
Okay, we have a quick question from Gregory first, and then we have Spanky next. Good morning.
Good morning. How you doing?
Good morning.
Just fine,
Gregory.
thanks.
Yeah, my question was, say over a 4 to 5 year period, my teeth became loose, and then I pulled them out myself, and my gums never did bleed.
Mm-hmm.
What does that sound like?
Were you a smoker?
No.
All right, what that sounds like, if you were able to pull your teeth out on your own, you had severe periodontal disease. And what happens is, when you pulled those teeth out, there was no attachment of those teeth in the bone any longer,
Right.
Probably very little attachment to the gums. So when you pulled it, there wasn't really any trauma anymore.
They came out very easily.
And a lot of that tissue was already atrophied and wasn't even, your teeth were just sitting in your gums, basically. And that's why you didn't have any bleeding.
And unfortunately, when that happens, though, you may have this much height to your bone with your tooth in place, but by the time that bone deteriorates and the tooth comes out, you've only got that much bone, which makes it difficult for people to wear a denture afterwards because the foundation that would hold that denture or partial has deteriorated so badly. So you don't want to wait till it's that long. As soon as you notice any mobility in teeth, you should have that checked out.
So are you replacing the teeth?
I would like to, but they don't take Medicaid, I understand.
Yeah, unfortunately, due to the reimbursement levels of Medicaid, they don't even cover the cost of what it for us to make a denture. It doesn't even cover that. So
Yeah, I've been trying to get teeth for approximately 4 years now,
Have you tried the dental school?
unsuccessfully.
Have you tried the dental school?
U of D Dental School, I'm sure they take.
Yes, I
Medicaid.
did, and they said they were filled up and they weren't taking any more at this time.
Well, make sure you get on the waiting list there, and there are other Medicaid clinics around the city where you could find somewhere to make you some teeth.
Pardon me?
I said there are other Medicaid clinics around the city where that would be willing to make you some teeth.
Well, keep checking with the UOD. That list shortens. People don't keep appointments or don't make appointments or don't follow through. So you want to periodically, maybe once a month, call and check and make sure that you're moving up on that list.
Okay.
Okay.
Thank
right.
you.
Thank you.
Okay, we have Spanky on the line, and then we have to call it a morning. Good morning, Spanky.
Yes, good morning.
Good morning.
Good morning.
Ms. Perryman, and to you two dentists as well.
Good morning.
I just had a comment. I was listening, and I heard you mention, for the first time, this is the first time I've ever heard a dentist mention hydrogen peroxide and baking soda, which
Okay.
I've been using since I was like 15 years old. And, I used to have a reputation of my teeth being white. Honestly, I didn't even know why. And people would say, I didn't know, they were just kind of looking in my mouth that closely, first of all, and they would say, your teeth are just so white. And I was amazed at, over the years, how many people, at least once or twice a month, would make that comment. And then, years later, I started hearing about the hydrogen peroxide and the whitening, and I said, that's why my teeth are so white. But for the two dentists to actually admit it, that that's what it is,
Well,
and again, I was doing exactly that, just from an antibiotic point of view, and it was, it really does make your teeth cleaner. I said, bingo. But at this point, I've kind of ruined my smile with actually chocolate. I'm a chocolate holic.
No.
Never any other kind of
Yeah.
like alcohol. I've never been a smoker or anything like that. But chocolate will just ruin your smile, people. So if you could avoid that, definitely do. But at some point, I look forward to coming in and putting myself in your hands.
Well,
And you just sound like you have what it takes to put my smile back in place.
Well, we appreciate you, Spanky, and we'll be looking forward to seeing
And
you.
I'll hang up and listen, off the air.
Okay.
Just to your comments about the hydrogen peroxide and the baking soda, because
Okay. Thank you.
it definitely works.
Good. Like we mentioned, when patients ask us
Okay,
a
bye-bye,
question-
guys, because I
Thank
can't
you.
hear
Thank
anything right
Okay.
now.
Okay. Like we mentioned before, like one of the other callers, when patients come to us, we're going to tell them the truth. I mean, we're going to take care of people and do them right, and we don't have any agendas or anything to hide. We're going to tell you what's going on, and we'll discuss it with you.
So once again, you're located at 13724 Woodward in Highland Park. It's 2 blocks.
2 blocks north of the Davison.
And your phone number?
Our phone number is 313-883-3050, and our website is www.livingstondentistry.com.
And
If your teeth are not becoming to you,
You should be coming to us.
absolutely.
absolutely.
Thank you.
Thank
you
you.
very, very much.
Thank you, Ms.
Golly,
Perryman, always,
We have a
Michelle.
lot to talk about this morning. Just can't get enough because we want to have a perfect smile, and you all will be back in a few weeks.
Yeah, we'll be
anyway.
back. We'll be
So
back.
get your questions ready.
And if I could just, real quick, if you could check out the website and see pictures of the office, you can see pictures of our patients, you can get all the information you need.
www.livingstondentistry.com.
There you go.
Ah,
All right.
Okay, everybody, we'll be back with Dr. Sabrina Jackson in just